how your medical bill gets so high even when you have insurance. Let me start with something I hear all the time. Doctor, I have good insurance, so why is my bill still so high? So, if you are ever opened a medical bill and felt that drop in your stomach, this is about you. You didn't miss anything. The system works very differently than people think. So, you think that insurance is assumed to be price protection. That's by definition. But this is the clear truth. Hospitals set prices. Insurance only decides how those prices are divided. So you would ask why people misunderstand it. Approval feels like safety, right? And the patient assume. But if insurance approved it, the price must be reasonable. But approval only means the service fits a contract, not that the price makes sense. Listen to this, and it actually happened in real life in my town. Couple of cases. Case one, the CT scan. A patient goes to the ER for an abdominal pain and gets a CT scan. Hospital charge $13,000. After insurance, patient still owed $3,000. Same CT scan at the freestanding imaging center nearby, $300. So 10 times more. Same test, same city, wildly different prices. This was not fraud. This was not malpractice. This was routine hospital billing. Case number two. It was a colonoscopy, same area, Southwest Florida. Routine screening, colonoscopy. Hospital outpatient department charged $20,000. Ambulatory center, $4,000. Patients still pay $1,000 because deductible and facility fees apply. Same colon, same scope, different building. Case number three, short hospital admission, 2-3 days admission for infection or observation. Hospital charges $80,000. Insurance negotiates it later. Patient still responsible for $7,000. No ICU, no complication, just how inpatient billing works. Why this keep happening? What patient never see? So let me show this down, because this is the part that explains everything. 1. Inflated hospital price list. The starting number problem. So every hospital has an internal price list, often called a charge master. Remember that word. Patients imagine this list will reflect real cost, fair pricing, or something close to market value. It does not. These numbers are often artificially high because they were never designed for patients to see. They were designed as a starting points for negotiation. So when you hear a CT scan that cost $13,000, that number doesn't come from the machine, the technician, the radiologist's time. It came from a pricing spreadsheet built for leverage. 2. Insurance negotiates it after prices are set. This is the illusion people don't catch. Insurance doesn't walk into the hospital and say, here's what it should cost. Instead, the hospital says, here's our price. The insurance says, well, we'll pay less than that. That feels like protection, but it's not. Because your deductible and co-insurance are calculated from the negotiated number, not from a fair market number. So even when insurance wins the negotiation, you can still lose. 3. Deductible reset every January, the timing trap. This is one feels almost unfair when patients realize it. Same test, same hospital, same insurance. December bill, manageable. January bill, devastating. Nothing medical changed, only the calendar did. January is not the most expensive month medically, it's the most expensive financially. 4. Facility fees stack on top. The building is billing you. Patient thinks they are paying for care. They are also paying for the building, the system, the branding, the overhead. That's what they call the facility fee. Same doctor, same test, different building, and suddenly the bill doubles or maybe triples. 5. One visit, many separate bills. Delayed shock, Patient expect one bill, healthcare deliver hospital bill, physician's bill, radiology read bill, pathology bill, labs bill, so often weeks apart. By the time the last bill arrives, patients are confused, exhausted, resigned. Complexity become compliance. Number 6, emergency remove all choices. In an emergency, of course, you can't shop, you can't compare, you can't ask for estimate. You are forced into the most expensive environment by design. That's where the highest bills are born. Negotiated does not mean reasonable. It just means agreed. Agreement happens between two powerful parties, hospitals, insurance companies. The patient is not at the table. So when someone tells you, don't worry, insurance negotiated down, what they are really saying, two institutions agree, and you are responsible for your portion of that agreement. I want you to think about this as buying a car, where the sticker price is fake. The dealer and bank negotiate, and your loan is based on their agreement, not on the car's value. You didn't misunderstand the process. The process was never built for you to see clearly on purpose. High medical bills don't require bad people. They only require prices set before patients are ever shown them. Sometimes the care is absolutely appropriate. The problem is not medicine, it's the pricing logic wrapped around it. These are 3 questions you have to always remember. They can save you thousands. First question, what is the total cost? Number 2, who is billing separately? Number 3, is there a non-hospital alternative? You are allowed to ask. You are not being difficult. Hit follow to help build momentum to fix healthcare in America. This is Dr. Ben Momber. Let me know what part surprised you the most, because your feedback sharpens the message.